evening, everybody. For those of you who don't know me, let me introduce myself. I'm Dr. Paul Maloof. I'm an orthopedic surgeon with Tidewater Orthopaedics. We're located here in Hampton, Virginia. That's where I am right now. We also have an office in Williamsburg, Virginia. So I just want to give you a little background about our practice. We are a private subspecialty group of orthopedic surgeons that I think we're very unique for the area here. This is really the only practice where every doctor that's in the group kind of focuses on basically one or two body parts. We've got a doctor who focuses just on spine. We've got hand surgeons, surgeons that just do joint replacement surgery. We've got sports medicine doctors that deal with shoulders and knee injuries and hip injuries as well. I'm the foot and ankle specialist in the group, so all I do is take care of injuries and problems that affect the lower extremity, the foot, the ankle. So I just wanted to talk to you a little bit about, the different things that we take care of here. Again, like I said, this is a very unique practice. We have an MRI at this location. We have a surgery center that we work at that's down the road at the Centera Careplex Hospital. It's a very, very unique place. It's probably the only hospital in the region that only takes care of orthopedics. It's an outpatient facility, so everybody comes in and goes home on the same day. Deal with very healthy people that just need, light anesthesia so they can go home. We're doing joint replacements there. We're doing spine surgery there. So it's a great place. So just to kind of hone in on what I do, I take care of injuries that affect the lower extremity. A lot of sports injuries like ankle sprains. That's one of probably the most common sports injuries there are. I see people all the time. I saw probably 2 or 3 people today in the office that came in. One girl had an ankle sprain from playing soccer a few weeks ago. She fell down, twisted her ankle in a soccer game, which any of you guys who have played sports as kids, a lot of you probably sprained your ankle at some point. Typically what we would do with somebody like that is we would ice them down, we would immobilize them. We might use something like this. This is called a cam boot. I'm sure you've seen people out. If any of you haven't had one of these, this would be something to immobilize you. This might be a little bit small, but this is a cute little one that we would use for somebody younger. Then we would start some physical therapy. We have physical therapy right here on premises. And we would rehab you back to doing whatever you want to do. Hopefully, if you just have an ankle sprain, you'll get back to doing everything pretty quickly. Another thing that can happen in that type of a situation is an ankle fracture. We see those all the time too. And people ask me, so how do you treat an ankle fracture? Well, a lot of times in a young person, a very young person, you could probably just put that person into a cast. But as we get older and our bones mature, a lot of times those injuries do require surgery. So, we do see a lot of broken ankles, and people are very active. They fall, sometimes in the winter time. We've had a mild winter this year, but people slip on ice, they break their ankle. It happens all the time. We see those injuries all the time. But there's many, many different bones. I have a model here in the foot. There's actually 28 different bones in the foot and the ankle. And you can fracture any one of these bones, and based on what type of fracture there are, we will find the appropriate treatment for you. But this is a model of the ankle. As you can see, it's very, very complex. Like we talked about before, the ankle sprain is when somebody's kind of walking along or they are running and they twist their ankle like this. And this is an ankle, this is the outside of the ankle right here, this is the inside, okay? This is kind of your big toe here. And if they sprain their ankle like this, they may tear the ligaments, and that will wind up giving the person pain, swelling, and eventually they could wind up having an unstable ankle. So there is a small percentage of people that have that type of injury that do wind up needing a surgery. So it's one of those things where you can't really tell until you come in, see us, and we kind of assess the situation and figure out what you're going to need, okay? Say somebody had an ankle sprain years ago, or they had many, many ankle sprains throughout their life. I see a lot of people that are maybe in their late 50s, 60s, or 70s who come in who said, I played football when I was younger, and I sprained my ankle 100 times. And I just wrapped up my ankle and I went back to playing sports or football or whatever sport they played. And then they come in at that age and they've got this swollen ankle, it hurts them. We get an x-ray and you'll see that the ankle has actually worn down and now they've got arthritis in their ankle, okay? So for those situations, we deal with a lot of arthritis here for all different body parts. In those situations for the ankle, some of those people actually wind up needing an ankle replacement. So I have here also a model This is actually an ankle replacement. As you can see here, there is 3 different parts to the ankle replacement. We will replace the top of the talus, we will replace the end of the tibia, which is the leg bone, and then there's a bearing in the middle, this plastic polyethylene bearing, which is really what the person stands on and rides on as they're walking around. This is an operation we do. It's not as common as, say, a hip replacement or a knee replacement. I'm sure many of you know somebody who's had a hip or knee replacement. It's hard to find somebody with an ankle replacement, but we do them here, we do them all the time, and I've got a whole list of patients that have had them that you can talk to if you're interested in that sort of thing. I was hoping to get some questions from the audience on any number of topics. If there's anybody out there who's interested in anything they want to ask me about. Do you have any questions there?
We do have one question. The first question is, what is a bunion and how do you treat it surgically?
Oh, that's a great question. That's a great question. That's another thing that we see all the time here. So I've got a little model here that kind of shows what a bunion would be, all right? So people come in and ask me, hey, I've got this bunion, here's a model, and usually, typically what it is that the big toe and the second toe have kind of spread apart. Let me try to get this in the right position. And then what happens is the toe starts to kind of drift over like this, okay? So as you can see on this side of the foot, they develop this kind of bump on the side of their foot, or the appearance of a bump. And people say to me, hey, can you just shave down that bump and get rid of this bunion so I can fit my foot into the shoe? But it's actually not quite that simple. So the problem is that these 2 bones, these are called the metatarsal bones, are actually spread apart like this. And when that happens, the big toe starts to drift towards the second toe. And what we need to do surgically is we need to come in here on this part of the foot, and we actually need to bring these 2 bones back together so that they're more parallel. Once you do that and you straighten out the big toe, that bump that you saw here actually goes away. So the bump is kind of an illusion. It's not really a bump that grew. It's really more the angle of the 2 bones that's creating that bump. And what I've adopted in my practice is a procedure that we call the lapiplasty. You can look that up online. I've even seen some commercials about it lately. But that surgery enables us to get the person walking much, much faster than the older style of doing that surgery. So that surgery is typically done as an outpatient. You would come in and go home on the same day. The anesthesia doctors that we have would actually numb your leg so you don't feel anything for the surgery, and then all you do is have some sedation to go to sleep, similar to, say, a colonoscopy or other outpatient type procedures. So you don't have general anesthesia, there's no breathing tube that you need. We do that surgery, we make a few incisions around the foot, and we straighten out the bunion, and then you go home. There's a couple of metal plates and screws that get implanted into the foot in order to hold things stable while they heal. Then you come back at about 2 weeks, we would take out the stitches, and then you go into a boot and you are able to walk on it. So you really only have to stay off it for 2 weeks for this type of a surgery. Then you'd walk on it for maybe 4 more weeks, and at the 6-week mark, we'd let you go into a sneaker, okay? It'll probably take a few months for it to heal completely, but that's usually, the in and out of that type of a procedure, okay? Any other questions?
Yeah, what is the most common type of ankle surgery?
The most common type of ankle surgery? Well, that's a tough question. There's so many different types of surgery that we do here, just because there's so many different problems that can happen. If I think about it, we do what's called ankle arthroscopy, which is a procedure where if the patient has some pain in their ankle or maybe some impinging soft tissue, we will do a procedure where we just make a couple of little incisions on the front of the ankle, and we actually insert a camera through a small tube into the ankle to actually look inside the joint and see if there's any issues that are going on in there. We can take pictures, we can insert instruments through another incision, and we can work through those little portals. Many of you out there might have had a knee arthroscopy. These are very similar type procedures, but we do that in the ankle. We see all different types of fractures. So somebody's up on a ladder. I would encourage any of you to not get up on a ladder, but somebody falls off a ladder, they might fracture their heel bone. I've seen that all the time, even from a small step ladder. And this bone right here fractures, and that needs to be put back in place. And a lot of times we use screws to hold it while it's healing. But I've seen many, many different types of fractures over the years. The ankle is probably the most common place when someone falls that they're going to get a fracture. Any other questions about different types of procedures we do?
Well, can an arthroscopy be used to treat chronic ankle pain?
A lot of times it can. A lot of times people, when they sprain their ankle, they may have kind of a minor sprain, and they may develop some soft tissue impingement inside the ankle joint. When that happens, people, as they're walking, they kind of pinch on that tissue that's in their ankle. And a lot of times you might give a steroid injection into the joint, and that may relieve some of the swelling that's going on in there, and that may help it. But a lot of times if that does not work, you do need to go in, you need to make a couple little incisions, like I said earlier, put a camera in there, and then you can remove that soft tissue that's impinging inside the ankle, and that can make it feel better. A lot of times there's kind of bands of tissue that may have developed from an old injury that kind of pinch when people are walking, and it kind of gives a catching sensation. And when that happens, we can go in again and do what we would call a minimally invasive arthroscopy, go in and relieve the pain from that procedure.
Thank you for that. What is the typical recovery time for ankle surgery?
Well, that depends. I think most surgeries, you're probably going to be staying off the foot for maybe 2, 4, or 6 weeks, usually not more than 6 weeks. If somebody has a broken bone and you need to fix it and put them in a cast, say, or a splint, the typical time for broken bones to heal is about 6 weeks. A lot of times, if you can't walk on your foot, you're going to have to use what's called a knee scooter. You may have seen people with those walking around if you're out and about. Sometimes people use crutches or a walker, even a wheelchair, but it is one of the more inconvenient parts of having a surgery on your foot is that you, a lot of times, will need to stay off of it. And we have staff that can help you. My main assistant, Stephanie, she's been with us for a long time. She usually can help you find anything you need as far as devices or anything you're going to need to recover from a foot surgery.
Okay. Can flat feet be corrected surgically?
That's a very good question. That's another thing that we see all the time. So just to give you another little anatomy lesson, on the foot, there's the leg is connected right here, and there's a big muscle and a tendon that comes down, and on the inside of your ankle, kind of we'll call this the inside or medial side of the ankle, there's a big tendon that runs down along the inside of the ankle and then attaches to the foot. And in some people, that tendon kind of wears out over time. That's called the posterior tibial tendon. When that tendon wears out, the foot does tend to collapse down and give somebody a flat foot. When somebody has a long-standing flat foot deformity like that, there's essentially 2 ways to make it feel better. One way is to put them in a brace, which means you have to kind of hold the foot and attach it to the leg and hold the foot in because the foot wants to flatten out. Wearing a brace can be very successful and can help treat that pain. If the person does not want to wear a brace or the brace is not working well enough for them, there is a surgery that can be done. That surgery entails kind of cutting a few of the bones, shifting them, and transferring tendons in order to pull the foot back into a normal arch situation. That's a big surgery, and we do that often. That person has to stay off that foot for probably 6 weeks after that surgery while the bones are healing from that procedure. But I've got many patients that have had that, and they go on to be very, very happy and go back to living their normal life and doing everything they want to do.
Next question is, will I set off the metal detectors at the airport?
That's a very good question. A lot of people ask me that question. And the metals that we use, I don't think are strong enough to set off those metal detectors. A lot of times the newer screening devices that they have will not really go off if that's the case. Many people do carry a card with them if they've had a joint replacement though, so they can show that that they've had this done. And we can provide any information that you need if you're going to be traveling.
Okay. Next question is, are there any dietary or lifestyle changes I need to make after foot and ankle surgery?
Well, this is kind of a touchy question. A lot of people do ask me that. The one caveat that I have going into any kind of elective foot surgery is I really try to get people to quit smoking. If they are a smoker, I don't want to be the smoking police, but cigarette smoking or tobacco use, and it's really the nicotine aspect of it, does not really go well with foot or ankle surgery. It will impede the ability for you to heal, and it will increase the risks that are associated with the surgery. The surgery already has inherent risks in it, and I really just try to minimize those risks as much as I possibly can. So if somebody comes in who's a smoker, I really try to get them to stop before they have the surgery. After they're healed, I tell them, you know, you can go back to doing what you want to do, but a lot of times I've had many patients that actually just quit and just said they were done with it, and they were very thankful for that.
And it looks like we have one more question here. How is a torn Achilles tendon repaired surgically?
That's a very good question. I had a gentleman come in today who was riding a bike, got off the bike, and felt a pop in the back of his leg. A lot of times people will tell me a story. They'll be playing basketball, and they feel a snap in their leg, and they turn around and they think somebody kicked them in the back of the leg. And then they get up and they feel like they can't walk or put pressure on their leg. And the Achilles tendon is the largest tendon in the body. So if you picture this ankle again, and the leg is coming up here, you've got the calf muscle with this long tendon that attaches to the back of the heel right here. And that tendon, in some people, will rupture. And if that ruptures, what we do is we take them to the operating room, we make a small incision. I usually make an incision about this big, and I grasp the tendon on either end, and then we weave sutures into the tendon. And then we bring those tendon ends together, and we tie all these sutures together to hold that tendon. Then once you've had that surgery, again, this is an outpatient procedure. You will go home right after the surgery. Once you've made it through the recovery room, you'll have a splint on your leg, and usually we have to take the splint and we have to kind of push your foot down a little bit like this to take some stress off that tendon, because the tendon is right here and we just reattached it. If we put your foot like this, we're going to be stretching on that tendon. So you'll begin a splint with your foot kind of pointed down like this, and that usually you have to stay off it for about 2 to 3 weeks. Then you'll come and see us. We take out the stitches, and then we'll usually put you in a boot, and in the boot, like this one here, you'll have kind of a little lift underneath your heel to keep your toes still pointed a little bit while it's healing. Okay? That injury takes a long time to heal. You'll probably be in physical therapy for 6 to 12 weeks after that surgery, and then you'll be gradually strengthening your leg back. Usually takes about 6 to 12 months after an Achilles tendon rupture to fully heal.
Okay, looks like we have one more. How is a Morton's neuroma treated surgically?
So Morton's neuroma, that's another interesting little diagnosis. So people will come in and they'll say that they've got this kind of pain in their foot. And most of the time they tell me that their third and fourth toes have kind of a burning sensation. They feel like they get this little shooting pain that goes into their third and fourth toes. And right between the third and fourth toes, there's a nerve, between all the metatarsal bones here, there are nerves. But for whatever reason, the nerve between the third and fourth toes a lot of times gets very irritated. Usually what I'll do is I'll try one steroid injection, and I'll give an injection in the office and see if it gets better. For some people it temporarily gets better and then the pain comes back. Some people the pain just goes away for good, and that's great. But if the pain goes away temporarily and then comes back, we usually make we do a surgery, make a little incision there, we remove the end of that nerve, and then that pain goes away. Sometimes people get a little bit of numbness between their toes, but most people will tell you that they'll live with that and they'll trade that little bit of numbness for the pain relief that they experience. So let me just say thank you guys for all being here with me tonight. I really appreciate your time. I know there's a lot of choices out there. Please come see us at Tidewater Orthopaedics. I've got a wonderful team here. I just want to give a shout out to Stephanie and Davina, the people that really make things happen for us. And if you have any problems, if you're questioning at all, please don't hesitate to pick up the phone and give us a call at Tidewater Orthopaedics. Thanks so much.